and today we are going to demonstrate a procedure in a plain English it calls a vampire face. We all know that Kim Kardashian went through it, or in a scientific name we call that PRP, which stands for Platelet Rich Plasma. Basically, these PRP has been in the clinical science and in the medicine since 1986 and been introduced by orthopedic surgeons for joint problem, ligament injury and tendon injury, and they were injecting these blood product back to the joint. So the technology behind it is since 1986, but now there have been lots of paper that they are discussing that the platelet, which is a component of our blood, is effective in skin rejuvenation, in wound healing, and it's not just for coagulation. So in a simple English language, the blood has got three basic component: red cell, white cell, and platelet. And vast majority of the blood has got plasma. The technology is to take the blood and spin it or centrifuge it in some devices in the one go, and sometimes you've got to spin it twice and extract the platelet from the red cell and the white cell. And sometimes you go up to 4 times concentration of the platelet in the blood. So the platelet normally in our blood is from 150,000 to 425,000, and it's just fluctuated in these two range of the numbers. And what we do is we concentrate that for 4 times for skin rejuvenation. So the procedure is in a couple of stages that I'm going to explain it today in our video. And it starts with the preparation of the patient. I have Anne-Marie in here, who kindly accepted to do the modeling for us for this procedure. Anne-Marie's been through a couple of procedures with us, Silicone non-surgical facelift, intradermal Botox and the Botox. And as a complete program of the skin rejuvenation of the face, she agreed with the plan to go ahead with the PRP or vampire face. So the first thing is getting Anne-Marie ready for the procedure. It starts from applying a numbing cream. As you see, I'm at the middle of applying the numbing cream. So what we do for the area that it's going to be a little bit problematic, we put the cream on. So Anne-Marie has got some kind of very fine wrinkles around the eyes. We're going to move on that area. Possibly she's going to receive 1 ml of the PRP solution in that area, which is under the eye. And then the laughing line in here and there, and also the jawline, they are again not just in Anne-Marie, in other people, when the skin starts sagging and aging, the gravity pulls the skin down, and then what happens? We get all these folds in there. So she's going to have a few injections in these area as well. You okay there, darling? Yeah?
Yes, thank you.
And the rest, if we evenly divide our injection to the different area of the skin, including as the area that we said we're going to get so focused in there. So the first stage of this procedure is to get Anne-Marie ready with the numbing cream, because it's going to be involved with a couple of injections. We're trying to make the procedure as less painful as possible. Aha, well done, well done. Well done, well done, well done, well done. Just hold it. Okay, as you can see, sometimes taking blood from the patient could be difficult, and because the patient hasn't got any vein, but we have to try a couple of places to entry, and sometimes it's a blind entry in fact. So we take now the blood, which is around 14 ml of blood in here, and then we're gonna centrifuge or spin this in 2 different stages. and I would show if every single stage of this procedure in order. So the platelet has got around 8 to 9 growth factors, and in fact it's the body's own product. And what does it do is stimulate fibroblast, which is a cell inside the skin, to produce more collagen. And this collagen, we call it that youth collagen, because as we age, the collagen type 2 in our skin change to collagen type 3. So in old skin or old age, we have collagen type 3. And that is responsible for sagging of the skin and the skin elasticity and flexibility reduce. Collagen type 2 is going to be produced in the skin after the PRP, because the platelet, after entering the skin via the injection or cannula insertion, they get activated. Of course, it's not just first day activation, maybe it takes a couple of days, and then it looks like a procedure starts. And that procedure is going to commence with the fibroblasts to, as I discussed before, synthesize the collagen. Also we've got growth hormone in platelet, and they all has got different activity and different procedure inside the skin for skin rejuvenation and a healthy skin. The procedure hasn't got any that much complication, apart maybe a little small bruising. We now done the we have taken the blood. So actually done. You okay there?
Yeah, thank you.
Okay. Okay.
Thank you, Dr. Zita.
Thank you. Thank you very much. Hold it like that for me. You're going to do that part?
Mm-hmm.
As you can see now, we have taken the blood and put them in the tubes. These are special tubes for PRP procedures. We can't do it in any other tubes. Now, what we're going to do, we're going to put these tubes in our centrifuge, and we're going to spin them. They're going for the first spin, and then after that I'm going to show you the second spin and what is going to happen to the blood product. So we start the procedure now, and as you can see, you can hear the spinning nose at the background. As you see, this was the first tube. Now we have separated the pure plasma contained the platelet from this tube. Now this product goes for the second spinning, and with this spinning we are going to completely separate platelet from the plasma for a purpose of the skin rejuvenation or joint injection or hair loss, because PRP there are evidence that it's effective in the hair loss as well. So I put these tubes now in the centrifuge for the second spin, and this time our spin is going to be different from the first one, and we start this procedure, and then the platelet is going to be ready for us for the injection. Right, now after the spinning, our solution is ready. If you have a look at the bottom of this, this is the place that our platelet now is sitting there. So the next stage is to extract this platelet with the concentration we need. As I mentioned, that for the skin we do the 4 times concentration, and for the hair and for the joint injection there are different concentration of the platelet needed. Now the next stage is, as we explained, the area of the problematic is the nasolabial fold and around the lips. So we try to, because we've got the cannula approach, we try to start from here and fan around this problematic area. Again, it's a point of entry for us, somewhere like here. And we enter to the skin, nicely moving to the problematic area. You okay, darling, there?
Thank you.
Can you see that my tip of my cannula is in there? And then I start injecting into that area. As you see on the orbital area, the redness already started for that area. So bleb bleb, we inject when we come out, and then the cannula give us the possibility to move more toward the skin, and that's for patients quite painless procedure as well. So we move more toward the lip area, which is again could be the problematic area. If you see, my tip of cannula is on the upper lip, and I inject. And again we do another maneuver to reach to the lip area, which is going to be in there, and then we inject. Anne-Marie has got a very delicate skin, and you can see that already the redness is coming through, and that's immediate effect. Now I'm gonna reach a little bit upper in that area, in the cheek area. You can see I'm in there now, and I inject to that area. Now, as I said, that cannula give you a quite flexibility to move around. So now I'm just fanning toward the cheek area. Can you see it? It's just going in, and I'm injecting more of platelet as subderm. So I'm gonna leave the cannula in and change the in this way. You may not encounter with multiple punching the patient. Again, we're going in to the other. You okay, Anne-Marie, there? Doing great, darling. The other area, and we injecting. Fantastic. The third area of the treatment is going to be the jawline. So I'm going to move on the jawline, and this way we give quite a good distribution of the PRP in the facial skin. And if you look at that area of the injection, it's already started the redness in the area, which we call that end point. So meaning that it's immediate effect of the PRP injection. Now, the third point of injection is going to be in here, and I'm gonna fan that area quite nicely from there all the way through to help with the jawline and the dropping of the skin at that area as well. Okay, darling, yeah?
Yes, thank you.
A little bit light in here because we have used the numbing cream, and it doesn't feel that much pain, but the reason behind it is the skin is numb. We can't use the numbing agent with the PRP, as may interfere with the platelet procedures of the healing. So So we come out and we go in to the skin. Sometimes finding the point of entry could be a little bit difficult due to bleeding or others, but normally you should could get there quite in one go. I'm in again, moving toward the problematic area that we discussed, and start injecting on that area and jawline. You okay there, darling?
Mm-hmm.
Doing great. So we inject, we come out, we go in again, we inject, and we come out. So that we call that retrograde injection, which is quite useful. The PRP benefit is because it's a procedure from you to you. It's a human being product, a blood product to human being. We don't have that much complication, and with the invention of the catheter or the cannula, we reduce the bruising. If you look at here now, I'm on the jawline and I'm injecting to the jawline, which is going to be evenly distribute of the platelet. So this way, Anne-Marie on this part of the face had just 3 injections, one there, one there, one there, and you can see the skin started flourishing. Normally we get 8 mils of the PRP per 40 mils. We've got same amount in here. I have already spent around 3.5 mils on this part of the face. I'm gonna get focused on the other part of the face, which is gonna be the same procedures of doing the right side of the face. So we have reached the end of our session. I'm just gonna wipe Anne-Marie and a couple of words from Anne-Marie to see how was the procedure for her, and of course she did very well. She was quite calm through the procedure, and if you look at the end point, quite redness. I'm going to give Anne-Marie the mirror to have a look. And our mirror is in here, Anne-Marie. Have a look, darling. I'm going to switch you up. So you see that all the redness is going to, and the puffiness. Can you see under your eyes? It's quite puffy, but that's going to settle, right? And how was the procedure? Any pain that you encountered?
It was just more delicate around the eye area. These bits were absolutely fine, but obviously because that is quite a sensitive area.
Yes, of course, yeah. But I think that the effect is gonna be in 2 weeks' time, and you're gonna see that the skin is gonna flourish in a matter of 2 weeks' time because of the effect of the PRP. Thank you very much for listening. If you need more information, you can see it in our website www.cosmeticfacial.co.uk. We also have some teaching material that you can download from the website, and wait for more videos from us in other cosmetic procedures. Thank you.